Hi, my name is Brandy. I'll be your student nurse today. Can you tell me your name and date of birth? Alright, thank you. Do you have any allergies that I should know about? Any allergies to any beta iodine or any chloroprep or any latex or anything like that? No, you don't? Okay, good. Alright, so today what I'm going to be doing is inserting an IV into your arm. Alright, I'm going to give us a little privacy and I'm going to do a little hand hygiene so we can get started. Alright, so I'm going to check for my arm placement and get it where I want to. And this is where I want the arm to be. Alright, so next I'm going to go ahead and get all the supplies ready. Alright, I'm going to go ahead and flush my my IV extension set. Alright. Alright, and this will have at least like 10 milliliters of normal saline in it. So I'm going to be careful with my extension set, and I'm going to go ahead and I'm going to insert my blunt tip into my IV extension set, being sure that it's unlocked. Alright, then I will go ahead and prime it, make sure we didn't have any air bubbles or anything. Alright, and it went to the end. Okay, so I'm going to set this to the side for right now. Alright, now I'm going to get my tape ready. If I can get it. I'm going to have to use a different roll. Alright, so after I've got that done, now I want to make sure that I have my correct catheter, which is a blue 22 gauge catheter. And I'm just going to go ahead and stick this right here. I'm going to stick my extension set right here as well. And it still has a cap on it so it won't get contaminated. Alright. Now what I'm going to do is go ahead and put my tourniquet on. And I think I'm going to use this vein right here. It looks good and spongy, and I'm able to see the vein well. So right here. I'm going to go at least 6 inches above. Alright, so now that I've done that, now I'm going to go ahead and I'm going to put my gloves on. You still doing alright, sir? Alright. And wipe my site good, vigorously, making sure I'm cleaning the area good. Alright, after I've cleaned it, now I'm going to take my 22 gauge catheter. Alright, and I'm going to insert it bevel up. Alright, So I'm going to go in at a between a 10 and 30-degree angle. I'm going to insert it in. Alright, until I hear it kind of pop. And then I'm going to kind of tilt it down, observe for flashback, and I see it. So now I'm going to push the catheter in slowly as I would draw the needle. Alright, and I will dispose of this in the shock container. And while I have this in, I will make sure that I keep this secluded because I don't want any blood or anything to come back out. And at this point, I would hook up my extension set. Alright, and I can go ahead and let that go. Screw it on. And then I'm going to go ahead and take my tape. And I'm going to tape it down. I'm going to go ahead and, after I've taped it, I'll go ahead and flush it just to make sure that I have it in the right site. And then I'm also going to go ahead and tape the other side as well, just to make sure that I have it where I need it. Alright, and make sure I clamp the tubing. And then I can go ahead and take my blunt tip needle off. And then I will dispose of this per company policy. Alright, so after I have that in, and I've made sure everything was correct, now I'm going to start on my actual, well, I'm going to apply my tegaderm. Alright. So, alright. So I would place my tegaderm right here, making sure that I can still see my IV port. Alright. And I will go ahead and peel it away. Alright. And I would take off the sticker that's for date, time, and initials, and I would stick it on the side right here, just to make sure. Alright, and now is when I'm going to start my IV bag. Open this up. Alright, so I have my sodium chloride here, and I'm going to check for the right medication, make sure I have the right medication, the right patient, make sure it's the right dose, make sure we're putting it in the correct way, and make sure all of that is correct. Alright, I'm going to go ahead and hang it while I get my IV tubing ready. So I will go ahead and untangle this, making sure that this stays sterile. Alright, so after I have that all done, I'm going to go ahead and clamp it before I spike my tubing. Alright, and I'm going to hang this right here while I work. Alright, so I'm going to turn my bag upside down. I'm going to take this out. Once again, I want to make sure that this stays sterile. Alright, so I'm going to spike it. And my tube is clamped, so nothing should run down. I can go ahead and turn it back upside down and go ahead and fill the chamber up halfway. Alright, and now I can take my tubing and I'm going to unclamp it and just go ahead and prime it. Making sure that we don't have any air bubbles or anything. Once again, I'll make sure I wouldn't have any air bubbles or anything in it. Alright, and after I've primed it, I'm going to stick this back up here. And make sure that it's clamped, because we don't want any running out. Alright, and then I would take my alligator clip and making sure that this stays sterile. Take my clamp out. Alright, now the next thing that I would do is take another alcohol swab. And go ahead and clean the top of my extension set, because I haven't been holding it, and since it's been on the arm it could be contaminated again. So after I've cleaned it, and I can take off my top, making sure not to touch where my cap was on it. And I don't know if you can see, it's sticking in here. Alright, and I want to unclamp this and make sure that I unclamp my IV tubing as well, so we can get the medication in there. Alright. And now, as for discontinuing the IV, I would come up and I would clamp off the IV tubing. I would go ahead and take all my tape off, making sure I'm not being too rough on them or pulling their skin or anything. Alright, I'm just going to discontinue your IV, which is taking it out your arm, and I'm sure you'll be happy about that. And I would be sure to go ahead and clamp my extension set tubing, and then go ahead and take off my alligator clip. And I would dispose of this per company policy. And then I can go ahead and get some gauze ready, put it over the site, and slowly pull out the cannula. And keep pressure on the IV site, and then maybe put a Band-Aid on it, and then that's it.
Red button, right?